our five. Good evening, everybody. We're here tonight to share with you some information about getting the COVID vaccine and what the COVID vaccine is all about for your children in our 5 to 11-year-old age group, as well as our 12 to 18-year-old age group. And we're very blessed to have some local health experts here this evening to share facts about the COVID-19 vaccines and answer any questions to help us make informed decisions to help you make informed decisions for your children. So first, I'd like to introduce Dr. Lloyd Fisher. Dr. Lloyd Fisher is a pediatrician at Reliant Healthcare, and he serves as the president of the Mass chapter of the American Academy of Pediatrics. And thank you. In order of that you see on our screen, Dr. Beverly Nazarian, and she is a pediatrician at the University of Massachusetts Medical Center, as well as our school health consultant for the Worcester Public Schools. And she has served in that role for at least 20 years. Dr. Nazarian. Dr. Matilde Castiel is also here this evening with us, joining us as the Commissioner of Health and Human Services for the City of Worcester. She is also an associate professor at the University of Massachusetts. Thank you. And we also have Dr. Christina Hermos, and she is an assistant professor as well as a pediatric infectious disease doctor at the University of Massachusetts Medical Center. And myself, Dr. Deborah McGovern, I serve as the director of nursing for the Worcester Public Schools and for the health services for all our students in the Worcester Public Schools. So we're going to start. I'm going to introduce to you, as I just did, all the physicians here with us this evening, and Dr. Castiel will begin the discussion tonight. Thank you.
So thank you, Dr. McGovern. Hi, everyone. I'm really thrilled to be with you here today. I'm actually in New York with my grandson who was just born, so I'm sharing that with you. But I thought it was important for me to be here to be able to talk to you about where we are with vaccines and the importance of all of you getting the vaccines, your kids getting the vaccine, your entire family getting the vaccine. We're still not where we want to be in Worcester. And so when we look at some of the data of what's been going on in Worcester, if we look at the population now with the new census, which is about 206,506 people in Worcester, we see that 67% have gotten one dose. And we have 57% who are fully vaccinated. And so we're still, when we first started talking about COVID, we were talking that we needed 80 to 85% of the people getting their vaccine so that they can protect everybody else. For those who didn't get the vaccine or for those who have immune deficiency. So if we're 57% that are fully vaccinated, we need to really keep going in that piece and get people vaccinated. Interestingly enough, when we look at some of that data, so people who are 65 through 75, so us seniors like me, we're actually greater than 95% vaccinated. So everything from 65 up is excellent. We've gotten pretty good vaccination rates for Worcester. Now, when we started looking at our youth, and we see that we're looking at 5 to 11, which is the group that just recently was approved for vaccinations, we still have a long ways to go. So we have about 17% of the kids right now, and this data is actually from December 3rd. That's the latest that we have now. We have 17% of the kids, 5 through 11, who've gotten one dose of the vaccine. So if we talk about kids 5 through 11 who are fully vaccinated, we're talking 1% of the kids who are 5 through 11 are fully vaccinated. So if we're looking at kids who are 12 through 15 years old, we have 52% are fully vaccinated. So still have a ways to go. If we're looking at kids 16 through 19, 47% are fully vaccinated. Kids, people who now, not kids anymore, almost adults, 20 to 29-year-olds, 53% are fully vaccinated. And then as we start getting up 30 to 49, the much better 74% vaccinated. So truly we have to get our youth vaccinated, and in particular looking at 5 through 19, or I should say 5 through 29, is where we're looking to really increase our numbers. We're also interested in increasing our numbers in communities of color. And that's part of what we've been doing in Worcester through the city, is actually going out into the community and reaching out to communities of color to get them vaccinated. I don't know if you know, but communities of color have been the ones who have actually gotten the most COVID, and they're the ones who are least vaccinated. So if I look at, for example, the Black community, we only have 47% of the Black community that is fully vaccinated, and 46% of the Latino community who's fully vaccinated, while we compare to the white community that's 65% vaccinated. So I'm here just more to tell you that we need to continue to get people vaccinated, and certainly to get communities of color. So Latinos, Black community, truly to outreach to them and get them vaccinated. I also want to make sure that people know that we're right now looking at fully vaccinated as the first 2 shots. And when we're looking at where we are right now, and I know most of you have heard of the Omicron variant of the coronavirus. I think we're looking at actually the 3rd vaccine, which is the booster, and that's what we're looking forward in the next coming times, to be able to say that actually you get your 1st dose, your 2nd dose, and you need a booster. And the booster has been shown along with your 1st and 2nd dose to actually cover for the Omicron virus. So again, what the data that I gave you was for the first 2 doses, but what we've been doing lately is also doing the booster vaccinations for everyone in the community. So again, reaching out to all of you to get your 1st and 2nd vaccine, and for those who have been fully vaccinated, to get the booster vaccine. So thank you.
And thank you, Dr. Castiel. Now we're going to share some slides with you, and I believe next on the agenda is Dr. Nazarian.
Unmute. Good evening. I wanted to talk a little bit about what is the effect of COVID-19 in children, because a question that I'm commonly asked is, well, do we need to worry about kids? Don't they just get mild infection? Is it better for them to just get the infection? And there is truth that in most children, infections are mild and they recover well and without sequelae. However, some children do get very ill, and it's really important to realize that about 1/3 of the kids who have been hospitalized or gotten really sick with COVID are kids without any underlying health issues. And COVID is very unpredictable. It's very hard to tell who it is that's going to be affected the most. So there have been 2 million infections in children in the United States, 8,000 hospitalizations, with about 1/3 of those in the ICU, over 5,000 cases of MISC, with I think about 29 of those in Worcester, just looking at it, bringing it to home, and about 700 deaths, and about almost 100 deaths in children ages 5 to 11. And to me, any death in a child is really is too many and not acceptable when we have a vaccine that can prevent that. We know now that COVID-19 is in the top 10 causes of death in our country for children ages 5 to 11. So while most kids are going to have mild infection, it's still a very serious infection for some with sequelae. The other thing is that children can easily transmit COVID-19 to others. And although we've been able to have a lot of people vaccinated, and particularly our over 65 group, as Dr. Castiel pointed out, our numbers in our community in particular still remain low. And also that children are also, they're helping to protect their younger siblings and others who might have immune issues. So it's another reason why it's really important that we protect them and prevent them from getting COVID-19. And then I think the other part, as we've certainly seen in this community where we had schools closed for a full year, the impact of COVID-19 on our children has been tremendous in missed school, in lost learning, in isolation, in mental health issues. And And now, fortunately, we have our schools open again. But I think looking at it, that if they get COVID-19 now, then it means missing school. It means, being quarantined. It means, being out of school. So that part is also a really big concern. Go to the next slide. So the CDC and the American Academy of Pediatrics recommend COVID vaccine for every child over the age of 5. And for children that age group, the vaccine that approved is the Pfizer vaccine, which is one of our mRNA vaccines. As you probably have heard, that requires 2 doses. And the second dose, just as in adults or in older kids, needs to be 3 weeks after the first dose. It's important to note that the vaccine is recommended even if the child has had COVID, because again, COVID is unpredictable. And although there is some natural immunity from the illness, it's also a bit unpredictable in terms of how long that immunity lasts, how well it protects a child or an adult, and in terms of how it protects against other variants and things like we've been hearing about both with Delta and Omicron. The dose is smaller than the dose for teens. Teens have the same dose as adults do, but it's exactly the same vaccine. And it's based not on body size. One question that families and parents may ask is, well, my 10-year-old is really big. Should they get the teenage dose? Or should my 11-year-old should I wait to have my 11-year-old who's going to turn 12 in January? Should I wait till January? And I think the main message is that you go by the child's age on the day of the vaccine. And it is based on their age because it's based on how their immune system works, not on their size when we're coming up with the dose. Go to the next slide. And I think then that goes to Dr. Hermos next, if I'm correct.
Yes, you are.
Is the slide going to advance?
Sorry, I had heard that. I just wanted to make sure that everybody can see the slide being on the agenda.
Hi, everybody. So questions that we get about the COVID vaccine in children is how effective and how safe it is. And we weren't surprised to find that the COVID vaccine was extremely effective in kids, as we knew it was in adults. In particular, because of what Dr. Nazarian said, that kids can mount really good immune responses, even at a lower dose. So in the trial, which was more than 2,000 children, it protected those children against any infection 90% of the time, and it was a 100% effective in preventing severe disease. So the patients who did get a breakthrough infection had mild infection. And they had no serious side effects, including myocarditis. And we've updated this a couple times since putting the slide set together because children are getting vaccinated so rapidly. The rate that children are getting vaccinated around the country seems to be outpacing adults when the vaccine became available to adults. So we already have almost 5 million children vaccinated. And there have been no signals of risks, apart from the expected risks of your immune response, like achiness or lymph node swelling, headache, for example. It's also notable that if you're vaccinated, you're less, and you do get a breakthrough infection, which again are mild, you're much less likely to pass that on to other people. So you are protecting all of your community, your loved ones, your family members, your child's classmates. So is this my part as well? Okay.
Yes,
So
Christina.
the just like for any other medication, I mean, if you look at vaccines in general, compared to other medications like blood pressure medications or cholesterol medications, they are the most widely studied group of medications because of the number of people who get them. So when a medication or vaccine, apologize for the dog, is approved, we call that phase 4, and we don't stop studying it. We still look for side effects that can only be picked up when many thousands of people are vaccinated. So we know that vaccines in general, like the measles and your diphtheria, pertussis vaccines, are incredibly safe. And this one works the same way. It stimulates your child's immune system in a very specific way. So there were no safety signals found when it was tested on small groups, like in step 1. And then it was given to specific groups so that the dosing could be adjusted, so it could be safe and effective. And then in larger groups, where we saw in the 5 to 11, it was 2,000 before the emergency authorization. And now, as we've seen, we've been looking at the potential side effects in up to 5 million kids.
And now I would like to introduce again Dr. Lloyd Fisher, and he will discuss with us a little bit more about potential side effects from vaccines, and hopefully answer some of those questions you have.
Actually, if you could go back one slide. Thank you. So how do we know, we get questions all the time about, well, this vaccine seemed to be created so quickly, it came to market so quickly, so how can we possibly know that it's safe? Well, the first thing to remember is that this vaccine, the mRNA vaccine specifically, which is the Pfizer and the Moderna, the technology was actually developed over 20 years ago. So it wasn't as though the virus first became discovered in early 2020, and then within 11 months, we had a vaccine out of nowhere. They'd actually been working on an mRNA vaccine for about 20 years. And they used information gained from what was formerly called SARS-CoV-1. COVID-19 is SARS-CoV-2, but there was a coronavirus about 20 years ago that we called SARS, and it has many similarities to COVID-19. And they actually were working on an mRNA vaccine for that virus. Fortunately, that virus never turned into a global pandemic, but the research and the data gained from that work 20 years ago is really what allowed a vaccine for COVID-19 to be created in such a short period of time. There was also so much interest in getting this vaccine out to market that there were many, many people willing to participate in the trials. So they were able to study this vaccine in a shorter period of time than would often take place. And then the other thing is there was so much money and resources that were put into the vaccine development from really across the world, that the manufacturers and the companies that were doing the research had more resources available than is typical for other medications and vaccines. And there was also, because there was such a desire to get this out faster than other vaccines, there was a lot of sort of what I would call political and bureaucratic red tape that doesn't do anything for the safety and efficacy, but just really delays the process. For example, when a vaccine is ready to be approved, it goes to a committee or subcommittee of experts of the FDA, and then it goes to the FDA, and then the CDC decides how it's going to be used, and that's done by a subcommittee of the CDC, and then the full CDC does the approval. There are sometimes 3, 6, 9, even 12 months between those steps for no reason other than there's not an urgency to speed that up. With this vaccine, all 4 of those steps, when the initial approval happened about a year ago for adults, that process happened in 4 days. All 4 of these groups got together, one right after another. So there really wasn't any shortcuts taken in ensuring that the vaccine was safe or effective. The next slide. So I often, as a pediatrician, parents ask me all the time, what are some of the side effects that we can expect from the vaccine? In reality, they're very similar to other vaccines that we give to children all the time. You often will get a little bit of irritation and soreness at the injection site. Sometimes you feel a little bit tired. These vaccines do tend to have a slightly higher rate of things like tiredness, headache, even some low-grade fevers and some headaches than some of our other vaccines, but those side effects are almost always very mild. They are relatively short-lasting. The side effects that we're seeing in children are no worse and sometimes less so than they are in adults. So if any of you have gotten these vaccines yourself, you can expect that your children will feel, some of the same side effects. I can tell you from my own experience, I personally, had the typical side effects after I was vaccinated. And I have two children that are in this new age group. I have one that's 11 and one that's 9. They just got their second dose last weekend, and they had zero side effects other than they were complaining that their arm was achy for a day or so, but they had none of the side effects that I had when I had the vaccine. So in reality, they're relatively mild. We really haven't seen a lot of severe side effects any different than we're seeing in older people and in adults. And they generally last 24 to 48 hours and then they go away. Also, keep in mind that the side effects such as fever and muscle aches are actually a sign that the immune system is doing what it's supposed to be doing. And the fact that your antibodies, the body's immune system is building up protection, and a response when your immune system is revved up is a fever, is achiness, is sometimes fatigue. So it's actually a sign that the immune system is doing what it's supposed to do. So the next time that the child is exposed to the actual virus after they're vaccinated, their immune system is going to know what to do and know how to quickly fight it. The other thing that I sort of wanted to address is we hear a lot of myths. There's a lot of, unfortunately, confusing information out there, information that people get from social media and other sources that is simply not true. And I think it's important to address those myths so everyone is aware and can feel comfortable that this is simply not true. So the main myth that I think we hear all the time is that there is some risk of infertility related to these vaccines, and that is absolutely not true. There is zero evidence. There has been zero cases where these vaccines actually affect infertility. Initially, there was questions about safety and efficacy in pregnancy, and it has now been shown that these vaccines are very safe in pregnancy, and it's now a recommendation that anyone who is pregnant gets the vaccine. There's also this myth that these vaccines, which are mRNA vaccines, cause the DNA of a person to be altered, and that is absolutely not true at all. I don't want to spend the time now because I know we want to get to questions in explaining why that's not true and why that's not even scientifically plausible. But you can go to the American Academy of Pediatrics website, aap.org, and there's a lot of good information geared towards parents. And there's some videos explaining why some of these myths just simply aren't true. A couple other things that you may hear that I'll just quickly mention that, again, has no evidence and they're just not plausible, is that the vaccine contains the virus itself, which is not true. It's not a virus. It's not a live virus. Doesn't even have viral particles in it. That there's a tracking device in the vaccine that has something to do with a 5G signal. That's absolutely not true. And then, the last two myths that I addressed a minute ago are that the vaccine was not fully tested and that the vaccine development was rushed. And again, those are both things that, I tried to explain a minute ago are simply not true at all. So the next slide. So one thing that is a true concerning side effect of these mRNA vaccines is something called myocarditis. And myocarditis is an inflammation of the heart. It can occur from many different things. In fact, one of the most common causes, or I would say the most common cause of myocarditis in young people is viruses, not vaccines, but viruses. And lots of different viruses can cause myocarditis. And what we have seen, especially in teenagers and young adults, is that a very, very small number of people in that age group ended up having myocarditis that developed somewhere between 2 and 4 days after their vaccine, most often after the second dose. It occurred sometimes in the teenagers, but again, it was extremely rare. And the thing that I think is really important to remember is that what we have seen is myocarditis occurring in teenagers and young adults, and actually older adults as well, after having a natural infection with COVID-19. And in fact, in every age group, including these teenagers where we did see a little bit higher rate of myocarditis after vaccine, the risk from the vaccine is still far less than the risk from actually getting the virus itself. And the severity of myocarditis, it seems that it's actually a different type of myocarditis after the vaccine than after the virus itself. And those who get myocarditis after the vaccine had a very mild course. None of them proceeded onto death the way they did in the sort of naturally infected group of people. And it was very short-lived. The average course for myocarditis after vaccine is pretty short, pretty mild, and not something that which should change anybody's mind to getting the vaccine. I think at this point, we need to accept the fact that everybody at some point is going to get infected with this virus, because as new variants come out, they become more transmissible. So nobody's going to escape getting it. Getting a vaccine is your best way to both prevent yourself from ever getting it, preventing your children from getting it. But even if you do have what's termed a breakthrough case after vaccination, the severity of that infection is going to be less. So when you are deciding between this very small risk of myocarditis from the vaccine and a small but larger risk from getting naturally infected, regardless of your age or risk factors, the risk from the vaccine is less than the risk from the COVID-19 infection itself. In the trial, there were 0 cases of myocarditis in the 5 to 11-year-old. Because it's so rare, it's possible that we wouldn't have seen it in the trial, but we expect that if there's any risk of it in this age group, it's going to be far less than it even was in the teenagers. And the reason for this is just the way this condition works. Teenagers tend to get it more commonly anyway than young children, who rarely get it from other causes. And the dose for the 5 to 11-year-olds is 1/3 of the dose that we are giving to teenagers and adults. So the fact that it's a lower dose, we would also expect it. Finally, we've now given 5 million doses to children. I think the last I checked earlier today, 1.8 million children 5 to 11 have gotten their 2nd dose already. And because we would see the myocarditis within 2 to 4 days after that dose, and we haven't heard about it in this 5 to 11-year-old population. So for any parent who says, I just want to wait and see what happens, we've waited long enough. If there was going to be a significant risk of this, we have enough kids that have now gotten the vaccine in this country that we can feel, pretty confident that we're not going to see any increased risk in this population. So I'll stop there.
Thank you very much, Dr. Fisher. So we would just want to let you know where your children can get vaccinated right now. There's a lot of opportunities, and number one being right there at school. We've been fortunate to offer as many of you will know, but we've offered the first dose a few months ago, and we are running 2nd dose clinics as well as 1st dose clinics currently in our schools, in all the Worcester Public Schools this week and next week. If you weren't aware of that, please look at the Worcester Public School website, where you'll find the clinic schedule as well as all the consent forms. You could complete a consent form and send it in with your child, or you can complete the consent form and use the health portal and send it directly to your school nurse if you have access to your student health portal. You can also go to the library at any point after these 2 weeks are over. Or you can go at any point starting now, every Wednesday from 11 a.m. to 7 p.m. and every Saturday from 11 a.m. to 5 p.m. at the Worcester Public Library. There's a team offering doses to children as well as adults. So as a family, you can get yourselves all vaccinated if you haven't done so already. You can also call your local CVS or Walgreens, as well as your pediatrician. I know the University of Massachusetts, the pediatric group over there does have the vaccine available. So check with your pediatrician first if you'd prefer to get it at your physician's office. And if you're still unsure, please don't hesitate to get in touch with one of your school nurses to help guide you in this course. Thank you all for listening tonight, and we're now open to questions. So if anybody has a question, we ask that you put it into the question and answer at the very bottom of the screen. where it says Q&A, and you can put a question into the chat box there, and we will answer it for you. If you need another language other than English, just click on the interpreter button at the bottom of your screen, and that will also provide you with interpretation. Thank you.
While we're waiting for questions, I have one that maybe Dr. Hermos could address. I know that there's been a lot of talk about the new Omicron variant and questions about whether the vaccines that we have now are expected to help protect against those. I don't know if you or Dr. Fisher have any comments on that.
The research on that is just coming out. So what I read today is we do experiments in like a petri dish, and you mix the new virus with the vaccine, and you see how much is neutralized or inactivated. And you need more antibody that the vaccine stimulates to inactivate Omicron than the other the types like beta and delta were the first ones. So you need higher levels of vaccine to inactivate it, which means that vaccine is our best defense. But the boosters for adults are really important because we need to get our levels optimized to work as best as possible against Omicron. So it's not going to be as effective. There are going to be more breakthrough cases, but vaccines are going to be our best defense, and anyone 18 and up should get a booster. That's going to be the best thing to do.
Thank you, Dr. Hermos. And I was also going to address some of the common questions, just a couple of quick questions that we heard through, that our nurses have heard in the school environment. One being that is, if my child already had COVID-19, why should I get them vaccinated? Or should I get them vaccinated? Or why should I? And so it is possible to be reinfected after having the COVID-19. And data does suggest that children may have some immunity from prior infection, but we don't know how strong that immunity is and how long the protection lasts. So therefore, getting vaccinated after having had the COVID is definitely a greater level of protection for your children. So we do
Actually,
recommend
that came out in this recent data too, that if you were previously infected and then you had 2 vaccines, you were the most likely to be have levels that can protect you from the new variant. So that's actually, nobody wanted to have the virus, but that's actually optimal. You don't want to rely on your natural immunity with Omicron. So previous infection plus the vaccine is a great thing.
Very good, thank you. One other that we've heard a lot of is, does getting the vaccine mean that my child doesn't have to wear a mask anymore? We all hope that someday we're going to reach that point, hopefully sooner than later, the more we all get vaccinated. And the CDC does currently recommend that we all still remain wearing masks in public environments. And where there may be a lot of COVID cases, particularly as we see in the rise in cases now. So it's even more important to remain vigilant. We know our children are doing great wearing them in school. And, we can all get tired of them and, get frustrated, but it's very, very important to continue to wear our masks, even when we're vaccinated. Because as the Dr. Hermos just talked about, the Omicron variant as well, and we may not have as the best protection. Wearing a mask until the Center for Disease Control does no longer recommends it is definitely the smartest thing to do, especially when you're in an environment with close contact with other people. Thank you.
I would just add, though, that the best way to get to that point is getting as close to 100%. We're never going to get to 100%, but as close to 100% of the population vaccinated as possible protects everybody. And that is our best way of getting to the point where everyone feels confident taking masks off.
Thank you. And I do see we have a few questions in the chat room right now. So if I may, if my child is currently in the test and stay program until Monday, but he's scheduled for his second vaccine dose this Friday, can he get it or should he wait? Dr. Hermos, your recommendation?
Oh, he should get it. So, I mean, the test and stay will hopefully result with negative tests. And then if one of those tests does turn positive, then you can talk to your pediatrician about the timing of the second one. But there's no reason to delay any significant amount. I mean, basically when the child is recovered, you could get the second one.
Thank you. Next, another question. How can you convince someone that it's impossible to change your red blood cells or DNA with just a vaccine? I have known there are some videos involving microscopes that have spread misinformation. Dr. Fisher?
Yeah, I mean, it's a hard question to answer in a short period of time. But, sort of the bottom line is the mRNA, the vaccine simply tells your body to make a protein. That's all it does. And in fact, the reason that these mRNA vaccines have to be stored at cold temperatures is they degrade very quickly and they disappear. So when you get an mRNA vaccine, it stimulates your body to make a protein. It's that protein that causes your body to have an immune reaction to make an antibody. The vaccine itself, the mRNA itself, degrades extremely quickly in your body, and it never gets into the nucleus or the center of the cell. That's where the DNA lives, but the mRNA can't actually get into the center of the cell. And that's sort of something that is probably covered in high school biology, and is something that I'm sure most people have forgotten about. But if you just sort of go back to some of the basics of genetics and DNA, that's really a simple explanation. Obviously, we can go into a lot more detail about the biochemistry, but I would recommend that there are some videos on the CDC website, and there's also some videos on the American Academy of Pediatrics or AAP.org website that really go into that in a nice, easy to understand way.
Thank you. I know you just mentioned, Dr. Fisher, well, in your previous comment in respect to herd immunity. I'm not sure if you used that word exactly, but I know we talked about the more we get vaccinated, the better we're all going to be. So this parent is asking what % of a population needs to be vaccinated in order to achieve herd immunity? And on top of that, what percentage is Worcester at currently?
Yeah, so we don't know exactly the percentage to achieve what's called herd immunity. And the reason for that is that it's a calculation that's based on how easily a virus spreads and how effective the vaccine is. So initially, when the vaccine first came out and we were dealing with the alpha variant, we thought somewhere in the 70s, 75% based on how transmissible and how effective the vaccines. As Delta came along, which was more contagious and maybe slightly less, the vaccines were slightly less effective against that, we needed a higher number, sort of into the around 80% is what people estimated. We don't yet know with this new variant, we don't know how much it's going to take hold in the US. We expect that it will spread just based on what we've seen elsewhere. And we don't know exactly how transmissible it is. And as Dr. Hermos mentioned, we are getting some early evidence about how well vaccines hold up against it, but we don't have real world evidence. So we need to wait for that. I think, again, everyone sort of has a different guess, but, I feel good when we get to sort of that 90% that we're in good shape. I don't know that we can say that's truly herd immunity, but I think if we can get to 90%, we're doing pretty well. I don't know if Dr. Hermos has any more to add.
That's what I was just going to ask. Thank you.
It might sound a little Debbie Downer, but we're not going to get herd immunity with this one, because this isn't like measles where we have a 99% effective vaccine and a 90% vaccination rate because we're getting everybody before they go to kindergarten. That's how you get herd immunity when we just do not see measles. So what we're going to see with COVID is that it's a flu, and we're going to have seasonal waves, I think, forever. And the goal is that we have a highly vaccinated population so that we don't have people ending up in the ICU and overwhelming the ICUs. And your kids can go to school. They might be exposed, but they will be much less likely to get infected if they're exposed, bring it home to their grandparents. And it's going to be a new normal. But what we need to do is make this a much less devastating infection by vaccinating the population. The chance we had for herd immunity was when the vaccine first came out, and unfortunately, we didn't have 80% of people just go out and get it. If we had, we might have been much closer, but we're not going to get there at this point. But the vaccine is the best thing we can do to save lives, essentially, and keep our kids healthy.
Thank you, Dr. Hermos. I don't see any further questions in the chat room, but I do have another one that was put forward earlier. And I just wanted to address that. And what if my child, excuse me, what if my child has severe allergies? Can they still get vaccinated? And, I'd just like to briefly answer that with, talk with your child's pediatrician first. If your child has had allergic reaction to any ingredients in the COVID vaccine, and or a health condition that might make you concerned about your child getting vaccinated, and your pediatrician will be able to give you the best information. And what I can tell you is that in most cases, children with severe allergy can be vaccinated very safely, as long as we do it in a safe environment and closely monitored. We do monitor all children in our school setting for 15 minutes following vaccination. In case there's going to be an allergic reaction, it typically will happen that quickly. But if your child has any of these issues that I just addressed, you would want to speak with your pediatrician. Thank you. I don't know if the doctors here would like to add to that comment at all. Okay.
I think only just to say that we get a lot of questions from people asking if it is safe to give the vaccine when they have asthma or when they have a heart condition. And I think that it's most important to say, like, yeah, if you have one of those conditions, it's even more important for you to have the vaccine. And the only real contraindication or reason why you shouldn't do the vaccine is if you've had a severe allergic reaction to one of the components of the vaccine. So if you have concerns and people have questions, yeah, you should talk to, their pediatrician, to your primary care doctor, and get their input, because they know you, they know your child, and can help guide you. But in general, it's a very safe vaccine. And if you have an underlying health condition, it's even more important to get the vaccine.
Thank you. I do have another question in the chat room. How do we inform people that getting the COVID vaccine isn't a government conspiracy? And how do we inform them that it doesn't affect someone's fertility? Perhaps we could address that. I'm not sure we're going to address the government conspiracy, but perhaps we could I think Dr. Fisher had already addressed about fertility, but I don't know if you want to add to that at all.
Yeah, I mean, it's a hard thing to prove. We know it's not scientifically plausible, right? There's just nothing in the vaccine that could possibly do this. As I said, it's mRNA that causes a protein to be created. But we haven't, there's been, studies now, we have information about women who have become pregnant right after vaccine, months after vaccination. We haven't seen any evidence that it does affect infertility. But again, just thinking about how the vaccine is created, what it is, what it does, there's nothing in it that really you could come up with how that would even happen. But
I'm going to disagree only in that we can prove it. If you talk to any of my colleagues who work in the nursery, we're having a baby boom. And these women, people have been vaccinated now for over a year. Wait, where are we? Almost a year. So if you think about it, it's just not happening. The women who were in the trials got pregnant, and they monitored those people, and now people who had the vaccine are having babies at the same rate as everybody else. So it does not cause infertility.
Right.
Two more additional comments that were added, with your discussion, whether, I think we answered that it's not affecting hormones, and Dr. Fisher, made that quite clear. And they want to know, how can we prove, some families want to know, how can we prove that woman that get pregnant now, but what about in 20 years from now?
I guess, I'd answer that about, there's never been a vaccine that has had long-term effects. It's just never happened. Most side effects that you're going to see from the COVID vaccine are happening within hours to days. But every other vaccine that we have available to us, if there is going to be any significant adverse effect, we see it within 2 to 4 months. So there's just nothing that has happened like that you could have. I mean, you could sort of say that with anything, though, is how do we know 20, 30 years from now something's not going to happen? And again, I just kind of go back to the mechanism, the science, how this works. And it's, clear that there's just no way that it would affect hormone levels now or in the future. And if there was going to be a change, we would see that now, because again, it's not affecting the DNA. It's not affecting how your body makes hormones, which through protein creation. So there's just no way that if we didn't see it right away, you would be able to see it 20 years from now.
I think it's a really important question, though, because this is something that people are hearing a lot of in the community. And I think it's really hard, as a physician, I try and say, like, you're hearing a lot of information, and you're trying to do your best by your child and by your family. And it's hard when you're hearing that same message over and over again, to not feel some worry. And I think about some of the things, we've all read a lot, and but it's really hard to try and make people feel something that you can't, there's nothing that we can show you black and white that, is a promise forever. But I think, when you're looking at these things like, when you're looking at these vaccines, someone explained it really nicely as saying, like, this is not a vaccine that stays in your body. It's not something that you're putting in your body that's, that's there. Someone made the analogy that it's like an email, the email is being sent to you, and you get the information from the email. And then what do? Then we delete it. We get the information, we do it. So think of the vaccine as coming in, it's training your body, but it's not something that is staying in your body. It's gone, really quickly. And I've also heard, and I don't know if this part is true or not, that the original comments about fertility were from some physicians in another country that were really against vaccines and started this message going. I don't know. It's just very hard when you hear things. So I think I give a lot of respect to people that are asking the question, because it is a concern. But we know from science, from everything else, from our baby boom in Worcester, that it's not the case.
And please talk to your child's healthcare provider, pediatrician, advanced practitioner, because we want to get these questions. We're never upset when we get these questions from parents and from families. We want to help you feel comfortable with the decision that you're making. We know that every parent wants to do the best thing for their child. And as Dr. Nazarian said, when you're hearing these things all the time, it's scary. So please ask us.
Thank you, Dr. Fisher and Dr. Nazarian. We do have another question here, and I think this is more direct, but we did discuss this a little bit, but I think this parent is looking for a little more information. My 11-year-old is very small and turns 12 in 2 months. She's the size of an 8 or 9-year-old. Why is the vaccine 1/3 amount for 11-year-olds but full for 12-year-olds? Why is it not by size and weight, but for age?
So
I'm sorry. Yes, thank you, Dr. Hermos.
your child is the exact same age as my twins. So, the first thing is that your child would get the smaller dose now, which is approved all the way down to age 5. So hopefully that is reassuring to you, since they're a small 11-year-old. We're giving it to small 5-year-olds. And to answer your question, the dose is based on the immune response. So children have more robust immune systems. So this isn't a drug that needs to get into your muscle cells or your fat cells or reach your brain. It just needs to get into the bloodstream and stimulate your B cells to make antibody. So the amount of B cells and their antibody producing activity they have isn't related to their weight, their muscle mass, or their body mass index. It's related to really their age and the maturity of their immune system.
I have another question. Thank you, Dr. Hermos. Are the vaccine companies liable if something happens to my child?
There's a longstanding precedent for that. which is that vaccines, because there's such a huge public health, they have such huge public health importance, really since the 40s, that there is a partnership with the government. So the government helps cover adverse reactions on behalf of the vaccine companies to help encourage the vaccine companies to continue to do vaccine research. Vaccines really aren't big money-making drugs, if you want to put it that way. So without this kind of protection from the federal government, they wouldn't be incentivized to make vaccines, which is what the public needs. So there is a sort of public-private partnership there to provide any reimbursement to anyone who might get injured.
Thank you very much. And I believe that that is all the questions we have. I think we've covered all those ones, the ones and any initial questions before this evening. And there are no further questions in the chat room at this time. So unless Dr. Fisher, Dr. Nazarian, or Dr. Hermos would like to add anything to these comments, I think we will wrap up this panel.
Okay. One thing I think I just wanted to say is that that to realize that there is a lot of information out there, and and parents are trying to do their research, and we get that. And I think as pediatricians and and nurses and providers, we want to make sure that you go and get to the right places for information. It's totally fine as a parent to go out and research and try and get information. And so just a few points, like I would say, avoid social media. We are all on there all the time, but social media, and so Facebook and TikTok and things, are generally not good sources of information. And so you want to go to sources like the CDC, the Center for Disease Control, the American Academy of Pediatrics, which represents, Dr. Fisher could tell us how many pediatricians in our state and country, but these are places that really are physicians and scientists and people who care about kids and spend their time doing that all the time. So going to those sources and kind of getting your information from those sources is really important. And then talking to your provider. I think in our state, we've done a lot of vaccines in pharmacies and in these mass vaccination sites, which was great. But you know what, for a lot of people, they want to be able to get their vaccines where they've always had their vaccines and where they trust people. And so we want to hear from that. And I really appreciate, the comments, the questions we've had in there have been great because they're on people's minds. And so it's really important to bring those up. Others can add on that, but I just think it's so important to get the right information.
Okay, well, it looks like we have another question. Is natural immunity, Dr. Fisher, better than experimental vaccine?
Dr. Hermos addressed this a little bit, but
I know you both did actually,
yeah.
but
So natural immunity provides some protection. We just don't know how long and how much and against which variants. And we know that vaccination after natural infection is safe. And what we also know is that vaccine after natural infection actually boosts your immunity. So not that we would ever recommend that somebody gets a natural infection, because you never know how severe it's going to be. But it does seem that those who had an infection and then got vaccinated are the most protected. So even if you have natural infection, because we just don't know how long it's going to last and how protective it's going to be, and we know that the immunity does wane and people have gotten reinfected, we want you to still get vaccinated even if you have infection. I just saw another, while I'm talking about how long does vaccine protection last, that's still an open-ended question. For younger and healthier people, it does seem to last pretty long against severe disease. What we are seeing is, with some of the new variants, it is not as effective against any disease. And that is actually a major reason why we all are now recommending that everyone who's eligible gets a booster dose, because it's safe, it's effective, and it will provide longer term immunity, both to the person who's getting it from getting sick, but also likely make it less likely that they're even going to get infected, so they won't be able to transmit it to other people in their family and their community.
thank you. sometimes, we need to repeat a few things, right? So we can understand it a little bit better or grasp it more, because it's a lot of great information being provided tonight. And in fact, one anonymous attendee would like to say that she was glad she listened because it helped her decide with more confidence. And of course, she wants her child to be protected, which is what we all want to. And so she's truly thankful for this event, and we thank you for listening. And we hope you spread the word just about how safe these vaccines are and how important it is to get our children vaccinated.
There were a few more questions. Well, one question I think I've had, and we've sort of addressed it, but I'll put it out there as well, is that a lot of things people have been saying is, well, you can still, and we've kind of touched on this, but you can still get the infection even though you've had the vaccine. I could let Dr. Fisher or Dr. Hermos comment on that. I think we all talk about this a lot with our patients, but I think that one's a really important one, because yes, there still can be breakthrough infections. But if either of you guys want to come, I think that's an important thing to get right before we close too.
I think we already addressed that, Dr. Nazarian.
Mhm.
And I think Dr. Hermos and Dr. Fisher already addressed that question. I don't know if there was anything more to add.
My guy who's a week and a half out from his second shot just made his get.
Wonderful, wonderful,
Looking healthy.
wonderful. So another anonymous person was wondering, how do we know that the person, how do we know if someone has a variant? Well, what I can explain to you, does the BioNext Now test tell you? No, it just tells us if there's a positive COVID test. In order to find out what variant that is, it needs to be done in a lab and scientifically in a lab. And we have labs right here in Worcester, Mass that are doing this every day and analyzing these tests to monitor variants. And they
We are
do
gonna
pool
be able to,
testing as well.
Our PCR testing looks for 3 genes, and with this new variant, it looks like the PCR can only pick up 2 of the genes. So we are going to get some ideas with the PCR testing, how much Omicron variant we're seeing just by the nature of the test result. So that's sort of an interesting thing.
Thank you very much. But you, as an individual, you won't know specifically, right? So, and are there any other questions?
Thank you. I'd just like to reiterate what Dr. Nazarian said, please come talk to us, come talk to your care provider. We're all here, and talk to your school nurses are doing an amazing job at helping and supporting and providing vaccinations to the school community. So really take advantage of that.
Okay, well, thank you, everyone, and have a wonderful evening.
Thank you.
Thank you.
Mhm.